Hello, welcome to my channel. This is part 4 and the last one for schizophrenia. These are questions and answers from RN NCLEX examinations. Please hit the thumbs up, please subscribe, please share this video. How can a nurse establish a trusting relationship with clients with schizophrenia is your question. The correct answer is respecting the client's dignity and privacy. It's best achieved by honesty. Establishing a trusting relationship is difficult with schizophrenia patients and should not be forced. The next question is, what would be your education for families with schizophrenia? The correct answer is effects of psychotherapy on clients. Next, in psychotherapy, much patience is required because clients often relapse. Next, psychotherapy may have limited effect because of chronic effects of schizophrenia. Next question. When nurse attaches consequence to adaptive or maladaptive behavior, the nurse is using what kind of approach? When nurse attaches consequence to adaptive or maladaptive behavior, the nurse is using what kind of approach? The correct answer is behavioral therapy approach. The next question. Behavior therapy can be a powerful treatment tool in what way? The correct answer, it helps client to change behavior. It helps client to change undesirable behavior. The use of consequence for behavior is the hallmark behavior therapy. The use of consequence for behavior is the hallmark of behavior therapy. Next question. What intervention would you use for diagnosis of thought disorder in a Milieu therapy approach? What intervention for diagnosis of thought disorders in a Milieu therapy approach? The correct answer is emphasize the rules and expectations of social interactions is the correct answer. Emphasize the rules and expectations of social interactions. These would be your interventions for diagnosis of thought disorders in a Milieu therapy approach. Next, we're going to be talking about evaluation of our patients. Who are the clients with best chance of positive progress of being diagnosed? I'll repeat this question. Who are the clients with best chance of positive prognosis of being diagnosed with schizophrenia? And the correct answer is clients late adolescence or early adulthood. Next, onset of symptoms precipitated by stressful situations. Next, clients with family history of mood disorders. Next, family history of schizophrenia is the answer. The question is, who are the clients with best chance of positive prognosis of being diagnosed with schizophrenia? We say late adolescence, early adulthood, onset precipitated by stress, family history, mood disorder, family history of schizophrenia. Our next question, what would be our evaluation for clients with schizophrenia? What would be our evaluation for schizophrenia clients? And the correct answer, evaluate confusion, perplexity at the height of psychotic episode, social occupational functioning, absence of blunted or flat affect, onset of psychotic symptoms within 4 weeks of noticeable behavioral change. Our next question, what is the recent research about the continuous use of antipsychotic medication treatment? And the correct answer is, relapse rate can be reduced to approximate 30%. The next question, symptoms experienced by client diagnosed with schizophrenia would predict less positive progress of which symptoms if observed? And the correct answer is client having little or no interest in work or social activity. Symptoms experienced by client diagnosed with schizophrenia would predict less positive progress if which symptom is observed. And the correct answer, client having little or no interest in work or social activities. What would be your teaching about amenorrhea, missing of one or more menstrual periods? Client is on antipsychotic medications, and your answer would be client on antipsychotic medications can experience amenorrhea. Teaching would be that ovulation still occurs and there is still a potential for pregnancy. Client is on Haldol, experiencing twitching on the side of the face, tongue movement. What are these side effects? The correct answer is tardive dyskinesia. If this is occurring, twitching on side of the face, tongue movement, tongue protrusion, client is on Haldol, this is a harmful side effect. And your question is, what are the side effects? And it is tardive dyskinesia. If client is experiencing tardive dyskinesia, The nurse will hold the medications and notify the doctor. This can be a severe life-threatening disorder which affects the larynx and the diaphragm. Next question. What are the signs of symptoms of tardive dyskinesia? A patient is on an antipsychotic medication, and the answer is repetitive, jerky movements of the face, neck, and tongue. Serious side effect: involuntary movements, blinking of the eyes, sticking out of the tongue, waving arms involuntary. You will hold the medication, call the doctor, stat. This is a life-threatening emergency. Please hit the thumbs up. Please have a good day. Please share this video. Take care. Thank you. My next videos will be on mood disorder coming up shortly. Thank you.